Well, let's speak now to Julia Manning, founder of the think tank 2020 Health. She's there in our central London studios. We're very grateful for your time. What do you make of this?
Well, I think things are better than they were a while ago. I mean, 9 years ago, I audited my patients and found that 50% of them hadn't been seen a year after they'd been referred. So we've made progress. But this report does show, and it is an independent audit, it does show that people are not having the information, patients are not having accurate information to make good choices over where to go for their treatment based on waiting times because they can't trust the waiting time data.
I'll come to the consequences in a moment, but in terms of the data not being accurate, are these mistakes or do you think partly deliberate?
Oh, I think fiddling the figures has gone on as long as the NHS has been in existence. So I don't think this is anything new. I think obviously there are always going to be inaccuracies which were inadvertent, but I do think fiddling goes on. But I do have sympathy with doctors because their discretion is taken away by this target. They can't decide who to treat first based on the urgency of the need. They have to go by the amount of time people have waited. So I do have sympathy for the doctors and the hospitals who are being criticised today.
So tell me more about those consequences that I mentioned. If the data that is out there is wrong when the ordinary members of the public are having to look at it?
Yeah. Well, as patients, we are told that we have a choice over where to go, and part of that choice is not just based on the outcomes, but also on how long we're going to have to wait. So if we're looking at figures which are inaccurate, we're not making informed decisions. I also think that for politicians, we need to remember this was a politically imposed target, and while the thinking behind it is right, that we shouldn't have to be waiting for months, sometimes it used to be years for operations. At the same time, we need to remember that if we take away that discretion from hospitals, then we are going to get manipulation as they try to meet what is a political target.
Now, I just read out what the response from the Department of Health, talking about the overall situation getting better, but specifically to the point about the data and it not being accurate, what do you think is the best way forward in terms of a solution?
Well, I think one of the things that the think tank 2020 Health talks about a lot is electronic patient records. If we had our own electronic record with integrated information from our GP, from our hospital, from social care, then there could be no manipulation of the figures. It would be there, and it would improve quality, it would improve safety, it would get around this problem of accuracy of reporting. I also think we need to do away with 100 pages of guidance that hospitals get about how long to keep people waiting. We need to give discretion back to hospitals, and then we also need to have independent audits. We used to have a great organisation called Community Health Councils who did this, but resources have been taken away, and what we have left is Health Watch, which simply don't have the resources to do proactive monitoring of local hospitals and local health services. That would give accurate, trustworthy information to the public on who is doing what, how long to wait, and what the quality and safety are like.
OK. Julia Manning, thanks for your time.